You know, there's a time that the older that we get, you know, might get a little long in the tooth or something like that. You might need some adjusting. That's when you want to see a chiropractor. And a chiropractor that deals with people from very young to, you know, on up there. Well, today on the show, we're talking to Dr. Justin and Dr. Candy Ford here at Back in Motion.
Nice
How
to
are y'all
meet you.
doing? It's good to see y'all.
Yes, sir.
You know, we've been here before, talked to Dr. Candy about the little ones. I mean, we're talking newborns up. And, you know, as far as the children and the moms and expectant moms. Dr. Justin, let's talk to you this time about, you know, people that, you know, the adults and on up, you know, the importance of, you know, proper maintenance of your body and keeping up with things.
Yes, sir. Well, like you said, Dr. Candy sees a lot of the pediatric side, and I'm pretty much everybody else. Anywhere from young athletes and playing football and baseball, basketball in high school and college. CrossFit has become a big thing now,
Yes.
and see a lot of people come in from that. All the way up to the geriatric population, you know, those folks that have got some high mileage on their skeleton at this point. And, you know, we really try to see as many people as we can, because everybody has a spine. Just like everybody has teeth and goes to the dentist, everybody has a spine. You should be coming to the chiropractor.
Well, you can
health.
get false teeth. You
Right.
can't get a false spine.
Can't replace your spine.
You know, there's a
yet.
lot of things they got all kinds of doctors for that you can put in your body and replace in your body, or, you know, enhance yourself. But the spine's not one of them.
Yes, sir.
They haven't got to that, you know.
It's a tricky place to do any sort of surgery, and that's why surgery usually is only effective 30% of the time. You know, and that's a roll of the dice. That's
Right.
not really that great of odds. But you can come in and get chiropractic work done. It's non-invasive. There's really nothing that's harmful about it.
Right.
All that you're risking is living life in pain, or coming in, getting fixed, and leaving that way of life behind you.
All right, well, they have some different ways of doing some of those adjustments. So let's walk back and show you some of those here at Back in Motion Chiropractic on Pass Road in Gulfport. Now, tell us what this is.
This is our Cox flexion distraction table, and
Okay.
what this is used for is those patients who have got some disc issues, maybe some sciatica, any
yeah.
pain, numbness, tingling running down the legs. And what that's from is either somebody went out and did a lot of heavy lifting over the weekend, maybe partied a little too hard out on the dance floor, and now has a swollen disc. And
Right.
what it's doing is it's compressing the nerves, and that's where you get that pain shooting through the area.
Right, right.
It could also be older patients who have just had years of wear and tear on their bodies and now have a bulging disc or
Right.
a herniated disc. Now we're allowed to work with herniations up to a certain point, and that's where the history and the exams and everything that we do in the office come in.
Sure, doing x-rays and everything. Will you show me how it works?
Absolutely. Go face down for me.
You know me, I'm in for getting a little adjustment anytime.
And so what we do here at the end is we're going to strap your legs in. It's kind of like a medieval torture device.
Oh boy.
And what it's going to do is it's going to bend in the middle at the waist, and your feet are going to travel towards the floor.
Okay.
So then what I come up here and do, you can probably feel a good stretch
do,
right
yes.
through the lumbar spine.
Oh
here.
man, that feels good.
And I'll find the hot disc and come right over top of it. And what we're doing is we're putting pressure against the vertebrae above it. So when your feet move towards the floor, we're actually separating that joint space in there, giving that disc some room to breathe.
Oh yes.
This is almost like one of those teeter hang-ups, but better, because not only are we just distracting the disc, we're actually doing a process called pumping the disc. And what this is going to do, it's going to help move fluid around. It's going to help move that inflammation and swelling around that's associated with a swollen disc. Take that pressure off of those nerves and everything. And when a nerve doesn't have pressure on it, it's happy. Now the cool part is I can bring you back to level. And then insert another part of the table, unhinge it, and we can distract you out to the side. And then I can also add back in the movement of the table. And what this is doing, when your disc blows out, usually it's on the left or the right. Rarely does it happen dead centered.
Right.
And so what this is doing is it's able to tackle a disc that's swollen on the right or we can swing your legs out in this direction and get it if it's on the left.
Oh, wow. That's awesome.
And then we bring you back to center. And at that point, after that, it's merely adjusting the spine at that point, just like we would in a normal chiropractic visit. You know, because keeping the sacrum moving is, this is like a old well pump at your granny's house.
Right.
You know, you sit there and you pump it back and forth and you get water flowing out of it. Well, every step that you take, this is moving fluid up and down the spine, up and down the spine. And when you get a sacrum that's locked on one of either side with the ilium, the sacroiliac joint, that's like that well pump handle is frozen shut. You have no more flow back here.
Right.
So what we do is we restore motion to here, restore the flow, you push swelling out of the area, and it takes all that pressure off the nerves in the area. From there, we can take you into our therapy room.
Your therapy room here.
Yes,
so
sir.
like, what does Lauren do here?
So Laurel's doing some rehabilitative exercises for the shoulder. And you know, a lot of times when you undergo an injury, your body protects itself, and it does that by re-engineering your movement patterns. Well, it's basically a bad education for the muscles of the body. So what we do, we put you through physiotherapy, which allows you to learn the proper movement patterns and the proper engagement patterns of that musculature.
Okay. Now over here, Dr. Candy is using, I guess, an ultrasound?
Yes, sir. This is ultrasound. Ultrasound is a great addition for those old chronic injuries that seem to just never ever go away. That heat gets really deep down inside of the joints and increases blood flow, increases oxygen to the area, promoting healing. The machine also has electric stim on it, which is great for muscle spasms. When you hook stim up, it's producing a small electric current about 100 times a second. And you do that for about 10 minutes, that muscle is going to be wore out. It has to relax. It has no other choice at that point.
We got about 30 seconds left. What would be one piece of advice that you would give to someone?
You know, health is your responsibility. It's not the doctors. It's not the insurance companies. It's not the government's, it's your responsibility. And once you begin to see it that way, the money that you spend on healthcare is no longer an expense, it's an investment in yourself.
It really is, it really is. And here, you know, you've got, this is, it's a family situation. You get have a real family type of atmosphere here, and it's great. And as you said, Doc, it is something. I mean, you can go out, you can invest in the car, you can replace that car, get a new car. This is it. You got one shot at it.
Just one.
This is it.
That's it.
This is it. So make the most of it. Take good care of it because that's all you're going to get it. Come check them out here. Back in Motion Chiropractic Center on Pass Road in Gulfport.